Everybody, welcome back to the Curacel AI Insurance Podcast. Very excited to introduce our guest here today. Toyin, would you like to introduce yourself?
Yeah, thank you for having me, Jeremy. My name is Toyin Deinde. I'm a business executive. I currently I'm Chief Operating Officer and Executive Director at Total Trust Limited. Total Trust Limited is a member of the Tangerine Group, and we describe it as a platform for providing insurance and pension solutions in Nigeria.
Hmm. Got it, got it. And very excited to dive into your responsibilities and things that you're working on today. So for those who don't know, hey folks, I'm Jeremy, Head of Community at Curacel, AI-powered infrastructure for insurance. Teams like Jubilee Insurance, Old Mutual, and AXA love Curacel because they saved over $40 million in fraud, waste, and abuse, automated their claims process, and reduced claims turnaround by over 70%. Jude, would you like to do a brief intro as well?
All right. My name is Chikezie Jude, Head of Regional Partnerships for the Middle East and North African markets here at Curacel. Nice to be on here with you.
Awesome, awesome. So, Toyin, let's dive right into it. Can you tell us a little bit more about Total Health Trust and also your responsibilities or role at Total Health Trust as well?
Okay, thank you. So Total Trust Limited started operations in 1998. So that means we've been in business for 26 years. I would, say that it is the choice health insurer for individuals, corporates who desire best-in-class health insurance solutions with I think for us, the thing that is important to us is about making sure that you have robust, comprehensive benefits, cover irrespective of the geography that the insured, would be in. So we have a couple of plan options for in-country cover, medical evacuation, African continent cover, global benefits. And in the last couple of years, we've been doing so much also around well-being as well as preventative care. So I would say for us, and we are a one-stop shop. We would say, considering also the fact that we're a member of Tangerine, and so some individuals, some corporates would want not just health insurance, but how do you get health insurance with, some life benefits or general insurance benefits or pension benefits. And I think it's all about ensuring that people have financial freedom, in summary.
Got it, got it. And can you tell us a bit more about your individual role on the team?
Yeah, so for me, I am currently responsible for leading the team for the health insurance part of the puzzle. That involves, general operations, strategy development, strategy implementation, really like the entire journey with our enrollees, and ultimately so that they are happy even while not accessing care, because there are a lot of things also, like I mentioned, beyond access to care even when people are not sick. So some of the advisory that we do, telemedicine offerings, annual medical checks, providing support. Some of our clients have health weeks, health week celebrations, and we partner with them to drive awareness. Ultimately, education, advocacy, and we have all that capability, and so I support each of every employee at Total Trust Limited to ensure that their own job deliverables are achieved.
Understood. And I want to talk to you and Jude in just a moment about technology and infrastructure in the insurance business. But right before we get to that, Toyin, I also want to ask you, so you mentioned strategy development for other managing directors, COOs, CEOs in the insurance industry in our community right now listening. Can you help us understand what is your approach to building insurance strategy? How do you build an insurance team, an insurance business, right? And yeah, what is your approach?
Yeah, I think, thank you, Jeremy, for that question. And I think it is important that, we um, divorce strategy itself from theory. It first starts with the leadership of the business. What exactly do you envision? Because we could be in the same business, and what I plan to do is different. I could choose to be the airline that lives on time. Another could be the airline that wants to provide luxury service, make you, treat you like a king. So if I am delayed by 10 minutes, it does not matter, because then people get to sip a cup of champagne and all that. So I think it starts from, what do you envision?
Mm-hmm.
So also is about really defining what markets you want to serve, and how best to reach that market. And I think in doing all that, it needs to be clear really what is the entire customer journey for your targeted market, and then you have a strategy map, to say, okay, this is what I want to be by what time, where am I currently, and what do I need to do to fix it. And it is also important that while we formulate strategy, that we actually have the end customer in mind, because you could be formulating a strategy that is just what you think, and because ultimately, then you're not serving the target markets, and so it is, I would say, strategy that is generic, even for businesses that are more like commoditized. It cannot exactly be the same thing. So defining your route to markets, defining your channels, defining, and in formulating strategy too is also about the business or leadership being honest to say, we would love to serve this market, but this is our competence and this is the capability that we have as at now. So we may not be doing this, or we may need to tweak it differently. If I were to, I want to be the closest burger shop to executives on Wall Street. I need to understand what executives on Wall Street, if I put my stalls or whatever it is on the train, do they travel mass transit? If I put it where they don't travel, then it's already gonna fail. If what part of my strategy is to go big on AI, and maybe social media, for instance, and then I'm targeting executives, and then I'm on TikTok. There could be a problem, because most executives are not on TikTok.
Yeah.
So I think crafting that with the honesty about where your business is at, the competence and the capabilities that you have, the market that you want to serve, and if you need to do it, do you have the resources, to make it happen, and how quickly can you make it happen? So I think those are also important rudiments in that entire game, in my opinion.
Absolutely. And I absolutely believe in that too. And there's a lot of different ways to execute that, and building the strategy with the market in mind, with the customers in mind. One way that I've found and learned over the years is just being on the ground, talking to people, talking to the customers, understanding their needs, their pain points, right? Like, do they travel by train, or right? Or are they on TikTok or LinkedIn, right? So, and just understanding, having that empathy and understanding of them, how they think, what they're thinking about, what keeps them up at night. But I want to transition into the technology portion of the podcast, and I'll pass this question to both of you, but we'll start with Jude. I'd love to understand, because I understand, Jude, you work with a lot of folks in the insurance businesses in the Nigeria area as well. What are you seeing in terms of technology adoption, and perhaps even AI, since Toyin mentioned AI strategy, in the insurance industry right now? What are you seeing, and where do you see the future of technology in insurance? Yeah, and we'll pass that question to both of you. But yeah, Jude, I'd love to hear your experience there.
All right. So for specific markets, so let me start with the market Mr. Toyin plays in. So for like Nigeria, we've seen Nigeria has very low insurance penetration over the couple of years, and that's because of the economic instability. But we've now seen with technology adoption, with digitized solutions, we've seen insurers able to have digital distribution channels, able to digitize some of their processes, and the ripple effect of some of this digitization and some of this adoption of like new technology is it ultimately reduces the cost of operations for insurance companies, and thereby makes insurance more accessible to people, because insurers don't lose that much money anymore when most of their operations are streamlined, and that means they can now enter new markets. They can now have more competitive pricing, and so that the ripple effect of all that adoption is technology adoption at scale and insurance penetration at scale. So we've seen insurers optimizing their processes with AI. We've seen some of them who didn't even have digital distribution channels now have multiple distribution channels in Nigeria now. Through bank applications, people can buy insurance. There's now very high awareness. People now buy goods in transit insurance. People now buy gadget insurance. And these things, some years ago, they were not very mainstream. So we are seeing a very significant adoption of technology here, multiple technologies actually, and it's really helping. And from where I sit in Nigeria, it's been really pushing the market in the right direction.
Hmm. And Toyin, how does this sort of compare with what you've seen, and also what Total Health Trust is doing as well in terms of technology in the business?
Yeah, thank you, Jeremy. And I think, Jude gave, a good picture of what is happening or what we're seeing. And interestingly, we partner with Curacel, for instance, to improve claims experience. And I think, like I did say, in improving operations, in developing your strategy, you need to understand the customer journey by interaction, surveys, feedback mechanisms and all that. Also by benchmarking what is out there in the industry, whether from your direct competition or, indirect competition. And thereby you can pinpoint, you can identify pain points. One, you can identify areas that we could do better, and then, people, have better experience. Three would also be, how do you make your own operations more efficient, more effective in terms of savings, in terms of, turnaround time and all that. So, for instance, I'll speak about two things that, we've implemented in our business. Was about, how to use digitization to improve experience. And then we talked about, telemedicine, people can access care for mild to moderate medical conditions from the comfort of their homes. We implemented that, shortly before COVID. And it was, a lifesaver because people were afraid to go to the hospitals even before the lockdowns and even after the lockdowns, because people, even while I had, if I had a musculoskeletal inflammation, for instance, I'm afraid of catching a bug that could even be more fatal than what I'm experiencing. And then we later on plugged it into, pharmacy, drug pharmacy benefits, people being able to, get their prescriptions online, and you could do deliveries, you could pick your medications from the nearest pharmacy, and then, experience improves, people are happier, people, then you can also cut some costs, because then you're also not paying for face-to-face consultation with medical doctors. When we started a partnership with Curacel about 4 years back, thereabouts, too, it was also about the fact that, our claims processing which is about the heart of outside underwriting of what health insurers do, could be more efficient. And I think for us, it was first from the point of efficiency. Then you pick up, also savings, because you can pick out duplication, you can reduce errors, then fraud, because then there is also that possibility of collusion, and then you streamline all that. And while I may not have exact percentages, about some of those savings we were able to achieve, it was obvious that was the right call to make. People, instead of getting your claims processed within 30 days, people could get their claims processed in about 5 working days. And that ultimately, enrollees are happy, healthcare providers are happy, even your people are happier, because they now need to streamline manual operations and physically vetting those claims. But I think, for us as a business, is also, we're also preparing for the future readiness, and also looking at some of the emergent risks, because also, while you're driving efficiency, talking about AI, if you plug in AI into your contact center and all that, there's also, and some of the other technologies, is also about how do we ensure that there is a handshake between some of these other technologies that we're bringing on, with your core systems. How do you ensure that you do not have different technologies in different silos? Because then you need to make sure that you are getting value from some of those initiatives or solutions that you have put in there. How do you also ensure that you risk manage? Because also there's a lot of risk, because when you put out a lot of your data, and particularly for those of us who are in industries, you do not want to get medical data out there. How secure is the entire, IT architecture? Then we are also getting emerging risks rather, cyber attacks and all that. So it all has to be well thought out, and it's all part of the strategy, to ensure that while you're trying to build a more efficient business, you don't get, held by the jugular. And then you have medical data or enrollee data being compromised and all that. I think just thought to add that into the discourse.
Absolutely. I think those are all really, really good points. I wanted to ask Jude if you have any thoughts on some of the points that Toyin mentioned, from the perspective of the insurance business. If we suddenly start getting multiple pieces of technology that we have to juggle around, integrate, work with, also understanding that the future landscape of cybersecurity, AI is also going to increase, right, the number of attacks, but also AI is going to help defend, against attacks. I'm curious, Jude, if you have any thoughts on those two challenges.
Yeah. So, I also wanted to ask a couple of questions based off what Mr. Toyin said. So, based on your responses, I also want to ask, from your perspective, I believe as the COO of THT, you have like full oversight, and then everything runs through you. What specific challenges, around adoption to technology, around some of this, even for our solution at Curacel, around its adoption, there are challenges companies, especially in very traditional industries like insurance, who were very particular about hyper policies, about healthcare data, about protection and the integrity of the data. What specific challenges outside this have you faced with like the adoption of new technology? Has there been instances where there have been pushbacks against adoption of new technology, and how are you able to manage such situations?
Yeah, Jude, and I would, be frank. I think around this market, it's the first consideration is about costs. Interestingly,
Yeah.
costs. while so many businesses are aware of the benefits that they would get from technology adoption, it's also about cost of acquiring those solutions. And you now need to have a clear map to show to your stakeholders, particularly shareholders, of the return on investment. That's the first challenge. Then when you cross that hurdle, it is also the fact that people, and I don't mean just about employees at Total Trust. It's people generally are very cautious around change. People get scared of change, particularly when they do not understand it. So
Yeah.
we need to do a lot of education and all that. The third point too is also about the markets being ready for some of these solutions. And I would say when we introduced like the telemedicine solution, it's so many people were like, well, it's nice, but it's not really the in thing, because what you see is also cultural. The psychology of the people are very important, and people feel more comfortable with people. Even when they see doctors, they want to like, will I see you again? If they had a very good experience, they want to see that same doctor again. So those are some of the guarantees. Can you guarantee that, for instance, with telemedicine, where there you can't tell who the doctor at the other side would be, but I think slowly and surely we'll continue to keep up with the advocacy, preach the message, show all stakeholders the benefits, and continue to drive it. I think particularly around democratizing access, distribution, claims processing, some of the other things behind. Then, looking at also at the young population that Nigeria has, it's going to be clear that even if possible, someone will like, oh, you need to get an X-ray. I know, like, oh, do I need to come into the office? Can't I just put my phone in front, and you get my X-ray and tell me what's wrong? People are getting very mobile, going to visit a doctor and spending 30 minutes, waiting, traveling time and all that is no longer attractive. So I think, rather than focus on some of the hindrances, is to look at the larger picture and the gains we get when we get it right.
Interesting.
And Jude, we're getting towards the end of the podcast. Yeah, if you had like any last questions, please go for it before. Yeah, and then I have one final question as well. Yeah.
Okay. My final question is very straightforward, and that's because both companies have had previous synergies. We still do business. So how do you see like Curacel solutions? How do you see it helping you achieve the objectives and enhancing your overall claims management strategy?
Yes. So I think our experience has been, I would say, satisfactory, and that is why we're still with you. Otherwise, we are no charity, if I can put it that way. And sincerely, your solutions have obviously helped in our journey to where we want to be in the next 2-3 years. I'm aware that we're also even currently discussing on how to expand that scope beyond just we're exploring that possibility beyond just claims processing. I know that some of our other sister companies, outside of health, I see it in health. We are already looking at some of the other engagements. So I think, like I said, one thing that will be clear would be about how do we make it more affordable? Because then, that will make the discussion easier to land with other stakeholders. Second, also is maybe also as part of the interactions that we have, is also what do you see out there beyond, our own lenses? Though I'm not wearing glasses, Jude, I don't mean to pick on you. Is beyond what we see. What do you see there, in the markets? What do you see outside of Nigeria? Because, if you want to provide best-in-class solutions, you're not myopic about just what Nigeria is ready for, but also how to help us to grow our business, because that relationship can last longer when, our business is growing, then you can grow. I think the scope is limitless. That's how I would like to land that response.
Thank you. That's very insightful. That's very insightful. Jeremy?
Yes. Before we let you go, I want to ask you one last question here. 20 plus years experience in the pharma industry and now the insurance industry. I want to hear, do you have any career learnings that you think our audience, our community can learn from you?
Thank you, Jeremy. Interesting question, really. Interesting question. So for me, it's just like they say, maybe outside of digital, pictures, no two scenarios, no matter how similar, are exactly the same. The peculiarities, and I think even maybe while I made that transition almost about 9 years ago, and even now, even at that leadership level, I think we must be humble enough, patient enough, to really try to understand the business or the sector or the territory that we're going into newly. And while we may have heard so many things, the best person to learn from is the people. And I also believe my approach to leadership too is also that leadership is situational. There are times that you may just need to be quick with the decision making. There are times that you need to really make sure that you're taking all the inputs. And one interesting thing too also is that leadership could also you could also be unsure, and so it's okay to do it even when you're unsure, or when what I think, like Nike would say, just do it, and then you learn along the course correct, and once there is that will, to succeed, and you have the support of your stakeholders. I think the will really and the resources, your people, are very crucial components of your success.
Wow. Yeah. Being humble, being patient, learning, iterating, and yeah, course correcting, and being okay to be unsure. Toyin, thank you so much for sharing your wisdom with us. And thank you, Jude, for the wonderful questions. And thank you, everybody, for watching another episode. We'll have LinkedIn if you want to reach out to Toyin, learn more from Toyin. LinkedIn will be in the description. And thank you, everybody. We'll see y'all next time.